Good evening. It's Monday, March 23rd. Thanks for joining us tonight. I'm Maya Trabulsi. New information, new cases, and the county's first coronavirus death. We have a lot to get to, but first, some breaking news. Just moments ago, Mayor Kevin Faulconer announced the closure of all city parks, beaches, and trails after big crowds over the weekend. And yesterday, the city of San Diego closed its parking lots at beaches and parks to prevent crowds from forming. The Cleveland National Forest closed Three Sisters and Cedar Creek Falls until further notice. Lake Murray, Cowles Mountain, and Mission Trails also closed. If you're going for a walk, officials are urging you to stay at least 6 feet away from anyone who's not part of your immediate household. The mayor says too many people were ignoring those rules over the weekend. He adds that police officers will now be out enforcing them. These strategies are especially important as the number of cases rise and the county reports its death from the coronavirus. We're waiting for the latest numbers, but as of yesterday, there were 205 confirmed cases in our county. So this map shows the cities where there is at least one case. 118 people who live in the city of San Diego have tested positive. San Diego's homeless population is especially vulnerable to the coronavirus. KPBS Metro reporter Andrew Bowen says the city has plans to add many new shelter beds, including at the convention center, to prevent a public health catastrophe.
Many homeless San Diegans are older and have chronic health conditions, and most don't have access to proper hygiene. On top of that, the city's shelter system is crowded, making social distancing nearly impossible. That's why city officials are repurposing 2 facilities for new shelter beds: Golden Hall, next to the city administration building, and the convention center. Mayor Kevin Faulconer says the convention center is a centerpiece of the local economy.
And during this pandemic, it will be a centerpiece of our fight against the coronavirus. Many events and conventions are on hold for the time being, and right now there is no higher and better use for this facility.
It could be weeks before the convention center is ready to shelter the homeless. In the meantime, the county has nearly 2,000 hotel and motel rooms for people with symptoms of COVID-19 who have no home they can stay in. Andrew Bowen, KPBS News.
The economic impact is a focus for county supervisors, especially when it comes to local restaurants. This morning, supervisors Kristen Gaspar and Jim Desmond were joined by industry leaders. The supervisors want to waive some fees and order departments to review regulations that might slow down a company from reopening. The California Restaurant Association estimates 60% of local restaurants have closed.
And we need to do our part as county leaders to ensure we help the restaurant industry and small businesses that have all been negatively impacted here and throughout San Diego County.
Our president said the other day, we can't have a cure to be worse than the problem. And that's what I'm looking forward to keep from happening.
Local restaurants that are open for takeout and delivery are listed at SanDiegoRestaurantWeek.com. The website is being updated daily, and all restaurants are being allowed to contribute even if they're not a member. California's 2 largest school districts, San Diego Unified and Los Angeles Unified, are calling for emergency state funding for public schools. The districts sent a letter to their state legislative delegations saying as they plan for the weeks and months ahead, they need financial support. Together, they serve 750,000 students. San Diego Unified says it has provided online learning opportunities to last students through the start of spring break on March 27th. The district has also already served 50,000 meals to needy families. A dire warning from the top doctor in the United States. The Surgeon General is predicting the coronavirus crisis is going to get bad this week. Here in the U.S., more than 400 people have died, and there are more than 40,000 confirmed cases. Congress is working to pass a stimulus package that could ultimately give many families some money. Camila Bernal has more.
The war against coronavirus is intensifying across the country.
I want America to understand this week it's going to get bad.
As the coronavirus cases climb, more workers laid off. Medical supplies dwindle and doctors plead for people to isolate.
Stay at home.
The federal government activating the U.S. National Guard in 3 of the hardest hit states. California, Washington, and New York, the new center for the coronavirus crisis.
New York has by far the greatest need in the nation.
To save the economy from a depression, the Federal Reserve announcing an unprecedented rescue plan, including unlimited bond buying, 3 new credit facilities, and an upcoming Main Street lending program. The Fed says the programs will provide up to $300 billion in new financing. Meanwhile, on Capitol Hill, senators scramble to negotiate the largest federal spending package in modern American history. With the nearly $2 trillion package, most adults would get $1,200 and most children would receive $500.
We were this close. This close.
But Democrats blocking the measure, demanding stronger protections for workers and limitations on bailed-out businesses.
And our goal is to reach a deal today.
Yet coronavirus is complicating matters. Several senators are in quarantine after one of their own tested positive for the virus, proving this pandemic is touching all corners of American life. Camila Bernal, KPBS News.
This weekend, the U.S. border with Mexico was closed to all non-essential travel as part of the federal government's effort to contain the coronavirus pandemic. But as KPBS reporter Max Rivlin-Nadler explains, most people who need to get back and forth across the border will still be able to.
By the end of last week, traffic across the San Diego-Tijuana border, one of the busiest ports of entry in the world, had already decreased considerably. Gone were the hours-long vehicle lines as most people heeded California's shelter-in-place directive. The new restrictions are meant to limit crossings to only those with essential needs on either side of the border.
My name is Carlos González Gutiérrez.
The Consul General of Mexico in San Diego says many who regularly cross the border will be exempt from the restrictions. U.S. or Mexican citizens with existing permission to enter either country will be able to cross to pick up medicine, see their family, and go to school or work.
Our idea is to limit non-essential travel without disrupting the economic activity that has integrated our two economies for decades.
Gutierrez says it will be up to the discretion of the customs agents on either side of the border to determine whether the reason for crossing is essential. But for the most part, the closure is meant to cut down on people who are coming to either country for strictly recreational reasons.
At this moment, the Mexican government, what it's doing is we are respectfully and clearly, without having to read between lines, asking people not to travel south of the border for tourism and recreational activities. But we are not stopping everybody. We are not impeding people to go down if they consider that it's essential for them to go down.
Gutierrez stressed that American citizens who reside in Baja California should have no fear of being blocked from returning to Mexico after trips to the U.S. Max Rivlin-Nadler, KPBS News.
The coronavirus pandemic has caused national shortages of protective equipment for healthcare workers. KPBS health reporter Taryn Mento says this is making local medical employees feel vulnerable, and some local facilities are struggling to find supplies.
By the end of last week, traffic across the San Diego-Tijuana border, one of the busiest ports of entry in the world, had already decreased considerably. Gone were the hours-long vehicle lines as most people heeded California.
And this report was a joint collaboration of KPBS and iNewsSource. And iNewsSource is an independently funded nonprofit partner of KPBS.
Employees at UC San Diego Medical Center say they're worried for their safety. Registered nurse Shannon Cotton says hospitals like hers are limiting the use of protective masks known as N95s to certain situations. But she's pushing for all employees to have access.
Because that is what we need to keep ourselves protected, so we can continue caring for our patients.
A UCSD spokeswoman says they are not short on N95s now, but that could happen if medical staff are unnecessarily using them. The debate is playing out across the country and here in the state. Workplace safety regulators say N95s are necessary to protect workers from contagious diseases. But as shortages grow, the CDC says loose surgical masks are an acceptable alternative. The disagreement surged online when UCSD Medical Center physicians created a petition for the federal government to release its stockpile of equipment. More than 1 million people signed within just days. But here in San Diego, Public Health Officer Dr. Wilma Wooten says the county's supply of N95s is okay.
So I can tell you 100% assurance that for N95 masks, there is no supply issue there.
She says what they're struggling with here is gowns, gloves, and goggles. Even so, the county's Medical Operations Center head, Rob Sills, says the county is meeting supply requests from local facilities.
I don't think a day's gone by since the last week of November that I have not spoken to an emergency manager for one of our healthcare systems, and they are getting what they need.
But at Family Health Centers of San Diego, CEO Fran Butler-Cohen says that's not the case. The system that caters to low and uninsured patients is struggling to find everything it needs.
We need to be able to have that ability to see patients in the community and not send them to emergency rooms.
Late last week, Family Health Center employees received thousands of N95 masks for healthcare workers from the county. But they say they still have more needs. And they're not alone. Some facilities are turning to the public for donations, and the community is coming through. But more supplies help because no one knows how long the pandemic will last. Taryn Mento, KPBS News.
And that report was a joint collaboration of KPBS and iNewsSource. iNewsSource is an independently funded nonprofit partner of KPBS. Some senior living communities in San Diego County now have access to a limited supply of COVID-19 test kits, but there is still significant concern about this vulnerable population. KPBS reporter Amita Sharma has more.
The kits will only be used on elderly people who are experiencing COVID-19 symptoms. And those symptoms include anything from dry cough to a fever to extreme fatigue. One of the communities that has the tests on site, Belmont Village Senior Living, won't test employees. Workers at Belmont and other senior facilities in the county are screened for temperature and other symptoms before and after their shifts. Any of them who display COVID-19 symptoms will be put on quarantine out of the building. Senior care residences across San Diego County started banning visitors nearly 2 weeks ago. Several senior centers in the county and nationwide are extremely concerned about outbreaks because there have been frequent cases at many of these facilities across the country, so officials everywhere are watching the situation very closely. Amita Sharma, KPBS News.
Gun stores in San Diego County are seeing record sales during the coronavirus outbreak, but are they allowed to stay open? KPBS reporter Matt Hoffman takes a look.
Which of you are here maybe for your first time gun purchase in California? 1, 2, 3.
Gun stores in San Diego County are seeing lots of first-time gun buyers, many saying coronavirus fears drove them to buy a gun. But the governor has mandated that only essential businesses can stay open during the coronavirus outbreak. And while gun stores are not on that list, some are still open. So we asked county officials over the weekend about it.
We consulted with our county council. It is not our belief that gun stores are essential businesses based on the governor's executive order, and so therefore they should not be open in the county of San Diego.
We have no plans to close. We have not heard any lawful order to shut down.
David Chong is the owner of AO Sword Firearms in El Cajon. Last week we visited Chong, who said business was booming.
About 10 times our normal sales.
Chong believes forcing gun stores to close violates the Second Amendment to bear arms.
We have to be very careful not to get into a ridiculous situation where we are sterilizing the Second Amendment by saying, oh yes, you can keep and bear arms, but you just can't acquire any.
People are purchasing firearms because they're in fear for their safety. And if you shut down that ability, I just think that it's a potentially dangerous situation.
The San Diego County Gun Owners Political Action Committee represents about 24 gun stores in the county.
They're definitely being threatened, and they want to make sure that they're complying with the law, but they also want to make sure that they're fulfilling the responsibility to the community and people that want to, be safe and protect themselves.
Stores like AO Sword have implemented social distancing requirements.
We made provisions for them to stay 6 feet apart, and we keep on enforcing that and explaining it to the customers for their safety.
Chong also says the state system to sell guns and conduct background checks is still working.
Yes, the state system is still active.
The big question here is enforcement. It's up to local jurisdictions to act.
If gun shops are not in compliance, we would like to know about it, and we will have the appropriate law enforcement agency make contact.
A.O. Sword is in El Cajon, and City Mayor Bill Wells told KPBS, in El Cajon, we would not cite or close a gun store or any store unless they were blatantly violating social distancing standards. Matt Hoffman, KPBS News.
President Trump has issued a presidential major disaster declaration for California, making billions in federal funds available to the state. The president also recently approved declarations for New York State and Washington State.
Large quantities of medical equipment and supplies on the way, based on all of this, to those states, including respirators, surgical masks and gowns, face shields, coveralls, and gloves, with large quantities already delivered to Washington and to New York.
And 2 naval hospitals will be anchored on both coasts. Today, the USNS Mercy, home ported here in San Diego, departed for Los Angeles. KPBS military reporter Steve Walsh has more.
After receiving their destination over the weekend, the USNS Mercy departed San Diego for the port at Long Beach. Their mission is to back up local hospitals strained by the coronavirus, but not actually deal with patients impacted by COVID-19. Asked why they won't, Captain John Rotruck says it's not what they were asked to do.
That was the mission as directed to us by the president.
Rotruck commands the hospital side of the ship, which has 1,000 hospital beds and at least 9 working operating rooms. Instead of coronavirus patients, he says they will handle the normal patient load from area hospitals.
Whatever goes into a local hospital, it could be someone with pneumonia, it could be somebody with a broken leg. We will not be taking trauma directly to the ship, but a patient that has been exposed to trauma of some sort, like a motor vehicle accident, we may take that patient and transfer and continue their follow-on care. So very broad range of medical and surgical issues.
Normally, the hospital ship is prepared to leave within 5 days, but they will be in L.A. and ready to see their first patients tomorrow. As the outbreak impacts the Navy along with the rest of the country, the head of Navy Medicine West, Rear Admiral Tim Weber, was asked why more sailors haven't been tested for the virus, despite a growing number of cases, including aboard ships based in San Diego.
We do follow CDC guidelines, and the symptoms and history of the patient, when presented to a physician, a clinical decision is made on whether to test or not.
The Mercy's sister ship, the USNS Comfort, is undergoing repairs in Virginia and isn't expected to deploy, possibly for weeks. While the Comfort deployed to New York City after 9/11, the Mercy has never been deployed to back up the civilian healthcare system in the U.S. Steve Walsh, KPBS News.
And we are following all of the latest coronavirus developments for you at kpbs.org. Click on the Tracking COVID-19 link on our homepage and you'll be taken to the page with all of our recent reports. You can find that right now at kpbs.org. Parts of San Diego got up to 1/2 inch of rain from this storm, and more is expected this week. Lauren Rainson has a look at today's rain totals and our forecast.
Good evening. We continue to watch that counterclockwise swirl there. That's that next low pressure system, the culprit for more rounds of showers and Sierra Nevada snowfall. Still very beneficial rainfall. As we're working our way through the rest of the day, we're going to close out anywhere from 1/10 up to 1/2 inch more rainfall before today is all said and done. Let's break down the timing of this for you in the Futurecast. Any additional showers will be very light. Even this model's having a difficult time picking those up. We will also have a hard time ultimately clearing out. We'll certainly keep those clouds around in addition to that morning patchy fog. By Wednesday afternoon and evening, still can't completely rule out one of those spotty hit or miss showers. As far as the rainfall totals go, the further up in elevation you go, the more rain you're going to see. And like I said earlier, in the higher elevations, we'll end out today with up to 1/2 inch. Lower elevations up to 1/10 inch, 1 to 2/10 inch. For tonight, widespread lows in the 30s, 40s, and even in the 50s. 53 tonight in Chula Vista. That next cold front leading edge of colder air is continuing to sink its way southward. And that, combined with the Pacific moisture, will help tap into more of those showers between Tuesday to Wednesday. And ahead of that, though, we're far south, soaking up that sunshine. Widespread highs in the 60s. Ramona, you'll top out near 61. Oceanside with temperatures in the middle 60s by tomorrow afternoon. Not too shabby. Your extended outlook along the coast calling for a couple days worth of sun and highs in the lower to the middle 60s. We'll see the return of showers on Thursday with a high of 61. Inland, a lot of sunshine Tuesday to Wednesday, lower to the middle 60s. Showers will return on Thursday. Friday, highs in the lower 60s. Into the mountains, that'll switch over to snow showers by Thursday, a chilly 33. You'll start to bounce back as you're heading into next weekend. Last stop in the desert, plenty of sunshine mixing with clouds at times. Middle 70s on Tuesday, 69 Wednesday. Thursday, Friday with those rising temperatures. Reporting for KPBS News, I'm meteorologist Lauren Rainson. Back to you.
A week into school closures, some parents of students with disabilities are already in crisis mode. KPBS education reporter Joe Hong spoke with parents and experts about what special education will look like in the age of the coronavirus.
While distance learning is a possibility for most students, it is not feasible for many students with disabilities who require more specialized attention. Sahar Shefa said her son Cameron, who's on the autism spectrum, was making progress before the coronavirus shut down his school.
He was putting 2-word utterances together. He's starting to put 3 to 4-word utterances. He's starting to recognize sight words. Just things that getting used to the routine of school itself. He started getting toilet trained at school, which was completely shocked because it's something he does not do at home at all.
At school, Cameron was getting speech therapy and occupational therapy multiple times a week. He was also surrounded by peers, which helped his social skills.
With a child with special needs, it's kind of, as with any child, you're afraid of regression, right? But with a child with special needs, it's like once they regress, getting them back to where they were takes a much, much longer period.
Chris Brum is a special education professor at San Diego State University. He said for students with disabilities, school isn't just a place, it's a way to structure their lives.
Our kids in special ed really rely on the predictability, the consistency, and the routine of a given school day, of the whole structure of school, so that alone is just really disruptive.
But providing services like one-on-one speech therapy or occupational therapy will be a challenge in a time of social distancing. Kara Shikowski is the executive director of special education at the San Diego County Office of Education. She said districts in the county are trying their best to support students with disabilities.
We will look at the different services that students have and make individual determinations about what is safe, what is feasible, and what would be meaningful.
Experts like Brum say parents can find high-quality materials on district and university websites. But for core services like speech and occupational therapy, students like Cameron are in limbo.
It scares me a lot because my son, like I said, he's breaking through to becoming verbal. Like he's right on that cusp, and I just have a feeling that it's just going to, hopefully it won't. We're going to do everything we can, but I can't predict anything.
Joe Hong, KPBS News.
And we want to remind you about a partnership between KPBS and the San Diego Unified School District. It's called AtHome Learning, where children matter. Just by turning on the TV to KPBS 2 or any of the channels that you see on your screen, students can watch PBS content designed by their grade level on a block schedule. Grades pre-K through 3rd grade can watch from 6 to 8 a.m. Grades 4 through 8 can watch from 8 to 1 p.m. And then high school content will be broadcast from 1 to 6 p.m. There's also an online library that can be accessed on any smartphone, tablet, or computer, and you can find that at PBS LearningMedia.org. Pharmacies are one of the essential businesses that must remain open during the coronavirus pandemic. In fact, CVS is now looking to hire 50,000 more people. They're looking to fill full-time, part-time, and temporary positions as well. The company also announced a $500 bonus for current employees. Another company that's hiring? Instacart. It comes as demand skyrockets for grocery deliveries while people stay at home. The on-demand grocery startup plans to hire 300,000 full-service shoppers who are treated as independent contractors. The coronavirus is causing a lot of fear and anxiety, and for some, those feelings can be overwhelming. But there are ways to cope. Mandy Gaither has more.
From coronavirus to the economy, there's a lot to process right now. But the Centers for Disease Control and Prevention say there are ways to cope with all this stress. First, take a break. If stories or social media posts are making you feel overwhelmed, turn away from them for a while. Take care of your body, get plenty of sleep, make sure you're getting exercise and eating healthy. Meditation or simply taking deep breaths can also help melt some of the tension. Take time to unwind, do activities you enjoy, and connect with others. Talk to those you trust about how you're feeling. The CDC says people with pre-existing mental health conditions should continue their normal treatment and be aware of new or worsening symptoms. Understanding the facts about COVID-19 and its actual risk to you and the people you care about can also help reduce stress. And if the stress is getting in the way of your daily activities for several days in a row, get in touch with your healthcare provider. For today's Health Minute, I'm Mandy Gaither.
Doctors and nurses are reminding everyone to stay at home to help slow the spread of the coronavirus. Staff at UC San Diego Medical Center in Hillcrest shared these photos on Twitter. The caption says, "We stay here for you. You stay home for us." UC San Diego Health says they appreciate the compassionate care their nurses, physicians, and staff are providing to San Diego. A recap now of our top story, the city and county response to the coronavirus pandemic. Just in the last hour, Mayor Kevin Faulconer announced the closure of all city parks, beaches, and trails after big crowds over the weekend.
These are not actions that we are taking lightly. We know we have been encouraging the public, obviously, to get outside during the stay-at-home order. And I want to be clear, we are still encouraging people to go outdoors. But go outdoors close to home. It's time to protect.
County health officials just updated the number of confirmed COVID-19 cases to 230. There is still only one death, which was first reported